today. We often take our teeth for granted, but without the proper care, things can go downhill quickly. Gum disease is one issue that can be prevented if you know how to be proactive. And here with her top 10 most frequently asked questions about gum disease, welcome back family and cosmetic dentist Dr. Terri Alani with her Tooth Academy. All right. That's right, the Tooth Academy. All right. Like so many health issues, a lot of us show up when we're in pain and we've been inconvenienced. And really, if you do the maintenance, you never get to that point.
Exactly. That's why I'm here.
Yes.
Because,
all right. Yeah.
No, it's so true. And I'm trying to help people prevent these problems.
Okay, let's start with one, symptoms that suggest that you might have gum disease.
Okay, if your gums bleed when you brush them, healthy gums do not bleed, number one. If they're red, swollen, tender gums, bad breath, loose teeth, receding gum line, anything like that, if they have extreme temperature to extreme temperatures, then you most likely have some form of gum disease.
Ooh, okay. Do you always check for gum disease at your regular checkups?
Yes, we do. The dentist or the hygienist will do a survey of the teeth. We check to see if they're loose. We check to see the color of the gum. And we also use a perio probe. And I know the audience has felt this before when they go to the dentist.
This is those things we shouldn't see.
Exactly. It's our little probe.
Yeah.
And this probe has little increments, so that's how we measure bone depth. So you'll hear us say numbers from 1 to usually, hopefully, not any greater than 6. You hear 3s. 3s are healthy. It's the depth between the gum and the bone underneath.
Okay, so that's
4s,
what those little
5s,
lines
and 6s
there?
are not good, yes.
Okay.
So we do check. We also take x-rays. X-rays are really important. You can detect bone loss from just looking at the x-ray.
Okay, how often should someone undergo cleanings and a checkup? And I guess that also depends on how healthy or not your gums are.
Exactly. If they're healthy, every 6 months. But if you have been treated for gum disease, you need to go every 3 to 4 months.
Okay. The other thing I think a lot of people aren't aware of, the likeliness of gum disease and risk factors. They think that they have to be someone who hasn't brushed in forever or hasn't done this in forever. Again, it depends on what your health is like,
Exactly.
too.
A lot of times it's genetic, but there are people that have no risk factors can actually develop gum disease, and that's why we want to have it, we want to detect it early. So you have lifestyle factors, you've got stress, if you smoke, if you have a diet that's high in fat, low in vitamin C, those are risk factors, and also if you have heart disease or diabetes.
All right, there's so many other diseases that we're so afraid of, but a lot of people also don't realize that around the world, gum disease is probably the most common.
You know, unfortunately, as we get older, things change, right? So as you get older, maybe over 50% of people do have some form of gum disease.
Yeah. We're kind of outliving our gums and our teeth.
Yes.
We have to keep up with it.
Before, I will tell you a story. Before I went to dental school, I thought everyone over 50 lost their teeth. Oh. I really did. I did not know that people can keep their teeth forever. You can keep all your teeth forever as long as you take care of them.
Yeah, okay. What is deep cleaning and why do I need it?
Okay, a deep cleaning is when you have those pockets and you have tartar below the gum line. We have to do scaling and root planing. That's what we call it. Scaling is when we use these instruments. We have an armamentarium of 3 instruments here. I'll just take one out. These get below the gum and they take the tartar off, and then the planing keeps the root very smooth, so it keeps tartar from going back on. And a lot of times you have to have this done and then just go in every 3 to 4 months for your regular cleanings.
Yeah, and you know, the thing is with tartar, it's sneaky. Plaque and tartar is sneaky because I brush like pretty much after every meal, but I still have tartar and plaque buildup.
Exactly, and fortunately, we're the ones that can take it off for
you.
So.
Can you knock that?
Sure, Deborah, let's go for it.
Okay, knock that little piece off right there. Okay, number 7, are there conservative ways to treat the disease?
Yes, there are, and that's the beauty of this. Now we have conservative treatments. First of all, if you come in and your gums are inflamed, say you have gingivitis, because that is hard to detect early. We can detect it early, but the patients don't know. But we'll usually put you on a form of a antibiotic that you take orally, like doxycycline is a form of tetracycline. We might send you home with chlorhexidine, which is an antimicrobial rinse. It's alcohol-free. Then we'll get you back in, and if you still have those pockets, we'll treat it with a conservative treatment locally underneath the gum with Atrodox. Atrodox is a form of doxycycline, and it suppresses the enzyme that causes bone loss. And basically, this is not a sharp needle. We just place this. We place it. We don't poke you. It does not hurt. You do not need anesthesia for this. We place it underneath the gum, and it actually can help correct that.
Yeah, you're talking about this rinse over here. I know some people, their gums just bleed. We don't know why they just bleed when they, when they floss and things like that. That can also kind of slow down the bleeding.
That can help. It's an antimicrobial rinse. You don't want to stay on that forever, but yes, it can help. But if the patient's gums are bleeding a lot, Deborah, then there's usually some underlying systemic cause. Yes.
Okay. Number 8. When do I need to see a periodontist, and will I ever need gum surgery?
Okay. When you need to see a periodontist is after you've been coming in and you've had the conservative treatment, and we're just not seeing the progress, or you have really deep pockets. You need to go to a gum specialist, which is called a periodontist, and sometimes surgery is the last resort, but it does work.
Okay. And then complications from gum disease. This is the thing that we all need to listen to, because it's easy to kind of go, oh, I'll get in, I'll, kind of put off that appointment. But when you hear the complications that could have been avoided.
Okay, you can have tooth loss, heart disease. With diabetes, you can actually cause your blood sugar to spike. Very difficult to control. If you're pregnant, this is very important, and you have gum disease, the bacteria can actually pass into the baby through the placenta, and you have low-term birth weight.
Wow.
So it's very, very important to get your gum disease diagnosed early.
Yeah, and then number 10 that you're asked often is gum disease contagious?
Let's see what the audience thinks.
For all of you kissers out there.
Do you think it's destroyed my life, truly, as a dentist? But how many think it's contagious? No. Well, if I was going to bed, I'd win a prize, because it is. It can be passed through saliva. Research now has shown that family members have a tendency to acquire it through saliva.
Oh, look, they're all like, well, I was doing all my brushing and everything. That explains what happened there, right? Okay.
So it can be. So if you have a loved one or a family member, you're starting to date someone, you get them into my office, and I will take care of them for you.
All right. Well, Dr. Alani has a special offer for Great Day viewers. If you come in for a new patient exam and cleaning, you will receive free x-rays. If you'd like more on Dr. Alani's services, you can call 713-621-5141, 713-621-5141, or visit her online at TexasToothLady.com.